And then we're going to go live. We always record just in case something happens with the technology. Don't have permission to live stream.
It does this every time.
It's ridiculous, but sometimes it then pops up that we're recording live.
Yep.
Has it said that?
Mine says recording. Oh, but it doesn't have recording live.
Let's try one more time. Back. Now something went really wrong. We'll try. If we wind up using the recording, I will edit out this part. Live stream, Facebook. I have permission to live stream, we know that. Chip live. Learn about health care staffing and career pathways. Page. Chip, go. We're preparing the live stream. We did it. Okay. Oops. Does it say live on your end? We are live. I'm on the BChip page on my other screen. Hello, everybody. This is Dr. Jennifer Gardella, and I am here with the very lovely Executive Director of BChip, Kim Everett. Kim, how are you today?
Thank you, Dr. Gardella. How are you today?
We're doing great. Lot going on in the world, and we are here to solve one of the major problems. Today, we've decided to talk to you about healthcare staffing because there's two pieces of this crisis that Kim is working hard to address. Number one, where are the crisis gaps that we need to fill in the healthcare industry? And number two, the training programs that are available to people that want to go into these jobs. So, Kim, why don't you first talk about the work that BChip is doing? I know that there's work with the elderly population and elder housing situations that you're working with, as well as generally in healthcare. What's going on in the world of staffing?
Well, the first thing that BChip got involved in is because we launched the long-term care partnership, we saw similar challenges with our nursing homes, similar to what we're seeing in our hospitals, and that is around staffing challenges. And so we do lead the long-term care partnership, as you're aware, and that's the leaders of the 31 nursing homes coming together to talk about best practices and opportunities. And then we also found when we started meeting in another work group that we have a mental health work group. And what was the priority that came out of that group? Healthcare staffing, right? In the behavioral health world and being able to address the needs there. And then, of course, our health systems have been having challenges around healthcare staffing for quite a while now, particularly since COVID. And so we were able to participate with the county in a direct care worker grant. So that is a grant we have right now that if someone would like to become a certified nursing assistant or a home health aide, they can register with our program. The cost of the training is covered. There's some support service funds, so people can have help with childcare or transportation or get a laptop or scrubs or things of that sort provided for them so they can be successful. And then they're placed with a job placement position, either in a nursing home or with one of our health systems after they finish the program.
That is phenomenal.
Yeah, it's been really successful. We're really happy. The grant should accommodate up to 45 certified nursing assistants that will be, funneling into the systems in Bucks County.
And so 2 questions. Have there been people to go through it already?
Yes.
And so there's still grant money left, though, for others to join.
Yes.
And how do people get involved?
They just need to go to our website, which is bchip.org. And they will go to the long-term care partnership page.
Okay.
Colleen Campbell is our long-term care manager, and she leads that work. Or, of course, they can always just call BChip at the general number, which is 267-291. I have to peek and look. 782.
I don't blame you at all.
Yep, that's the general number. 267-291-7882.
Okay, fantastic. So why is it important that we share information about different types of career pathways with people?
Well, BCHIP is starting to put our toes in the water for a new initiative, and this is not really something that we're the expert on. So we're trying to really partner with our community college folks, our tech school partners, other educational opportunities and certification programs. I just think being the parent myself of 5 young adults, and knowing that some of them, I don't want to say any of them took a straight path to where they were going. Nobody woke up and said, I'm going to be a lawyer and went straight through to school and became a lawyer. But some of them kind of did this as they've determined they kind of struggled a little bit. Some of them have struggled a little more, and some are still bouncing all over trying to figure it out. Right. And so, to me, I think that's a really normal reflection of young people in our community. And so I know I was the first one in my family to go to college. So my mother, I never knew there was another choice but to go to college. It was you go to high school and then you go to college. And
Right.
so I have a lot of respect for my mom for that because that was something she really wanted for me. And fortunately for me, it worked out well. But what we're seeing, first of all, we know mental health is a huge concern for young people. There's all kinds of data telling us around the challenges with mental health in youth. And I think there's this enormous pressure on young people that college is the only way to go. This is not me saying I'm anti-college. Heck, I have a master's degree myself, right? So I'm not anti-college. I'm just anti thinking one way is the only way, right? And so first of all, we've started talking to young people. We've gone out and we've done some programming at some of our local school districts. And when you ask young people, how many, tell me the names of any people that work in a hospital. And we'll ask them, right? Like, what are the names of these positions? Who do you think works in a hospital? And you hear doctors and you hear nurses, right? Every once
Yeah.
in a while, they'll say an x-ray tech, right? Now,
Right.
we need doctors, particularly psychiatrists and primary care doctors in our country. We need nurses in our country, and I have one of those myself, and she does an excellent job and is very committed to that work. But there are so many other roles in healthcare that no one knows about.
They have accountants,
Accountants, they have painters, they
painters,
have they have IT people, right? They
right?
have chefs. They have so many people working in healthcare, some that are health related and some that are not.
Yep.
And I think that as I've experienced it with my family, I would have loved to have seen a couple of my kids be able to say, hey, I'm not really sure what I want to do. So instead of going to college and, really making some hard choices and learning some hard lessons and really struggling, right? Both financially, emotionally, all those things.
Oh,
How about I just say, I'm going to go to a class for 18 weeks and get a certification, and I'm going to go work in healthcare, and I'm going to see if I like it while I grow up a little bit, mature a little bit, see what those things are in healthcare that I don't know about, but now I'm exposed to because I'm working either in a hospital or a nursing home or a behavioral health facility, right?
yep.
So examples of that are behavioral health techs. If you think you want to be a psychiatrist, but you're not sure you want to make a 14 or 10-year commitment, hey, great. Let's go be
Right.
a behavioral health tech and see if we like this at all, right?
Sure.
And learn about the behavioral health world. Um, or maybe I want to be a nurse, but I'm not really sure yet. So maybe I can be an LPN or a CNA, or I can be a phlebotomist, right? We asked all the kids, stand up if you think a phlebotomist needs a bachelor's degree, a master's degree, or a doctorate degree. And they all had different things. And you don't need any of those degrees to be a
You
phlebotomist,
don't.
right? It's a certification.
Right.
And so they hear this fancy term and they think, that it's something, big and fancy. And so I think what we need to start telling our children, and the reason I wanted to talk about it with you today is because if we're visiting schools and we're giving these messages, but kids go home and the only message from a parent is still, you have to go to college, right? then that's not really helpful to our community, to young people. I think that I don't want to lower the bar, or as some people may say.
Right.
I've had that experience in doing some lectures. They said, "Oh, we're so disappointed we're lowering the bar for our young people," and I'm like, "No, no, no, no. That's not it at all. We're not trying to lower the bar. We're just saying let's think of other ways to get there." And we have examples of that on our BCHIP board. Some of our board of directors, some of the CEOs of the hospitals started out as orderlies or techs at a hospital and went on to be, one of them became, I think, a speech language pathologist, and then or maybe an OT, I'm not sure, I don't remember, and then went on to get a master's degree in business and now runs a hospital. So we have to stop thinking it's lesser.
Yeah,
And
I just spent the morning
yeah.
with the guys at hospitals that do government relations. So you want to go into lobbying or working, with state and local governments to get fund huge
Mhm.
careers in there.
Mhm. Yeah.
It's awesome. So you had some interesting stats about college that you shared with me before.
Oh, yes. I just let me pull those up so that I can actually
Because
make sure I'm
there's a
quoting.
lot of data to support the fact that students go to college and then wind up in a completely different area of study. Or, they're wondering, wait, I was just talking about this to someone else this morning. Wait, I have this $100,000 degree from this prestigious school. What does this get me? I didn't need this to even do my job. So a lot of students should start out at community college. It's a better fit for them.
Well, BJIP is so fortunate. We have Bucks County Community College represented on our board of directors. So I need to, certainly full disclosure, you need to know that. And in meeting with the new community college president a few weeks ago, Dr. Patrick Jones, we were able to start talking about, the value of community college. And so he shared some information with me that I just found fascinating. And to be honest, again, as a parent, I remember thinking of my kids, gosh, if you were smart from a financial perspective, everybody would go to community college and then go somewhere else later if
Yes.
you want your 4-year degree. Um, yes, it's a different experience, but gosh, it saves them so much money, right? But I don't know about you, Jen, but when my kids came through school, going to community college to their peers was just not acceptable. That was just not something that would have been valued at all.
Well, two of mine were in college during COVID, and I was paying upwards of, well, I was paying a lot of money for, especially one of them, for them to take courses online from apartments near their schools that were closed. And I was like, no, as I was also a professor at our local community college that knew and enrollment was dropping. So it was quite a weird circle for me to see what was going on at the community college level, which is an extreme deal, right?
It really is. And
And yeah,
with the cost of it being so expensive, which then ties into, you're talking about the apartment, and we don't have affordable housing in Bucks County. So,
right.
which just ties into a whole nother issue we can talk about in another session. But so I did find the data that I was mentioning to you. And so the community college, and again, this is information from Bucks County Community College, so it is biased, I'm sure, a little bit to some degree, but their information says that if you're getting a bachelor's degree, if you're committed to getting a 4-year degree, that by going to the community college, you can save anywhere from 26 to 72% on the cost of your degree. And they give different universities and examples. So for instance, if you were to go to the community college for a 2+2 program, so you go there for 2 years and then transfer to a partnering school that they work with. If you went from Bucks to Westchester, you would have a savings of $11,000 over the course of your 4-year degree. If you go from Bucks to Drexel and you have the first 2 years, you would save a total of $178,000. And
Right.
so, yeah, for
And you
the
walk out with the 4-year degree from the school that you finished from. I
exactly.
think where people get caught up though, and I know I can speak for myself, you know me, the queen of vulnerability over here, I'll share it all. Um, there was a hope that my children would have the same college experience that I did, where my college friends were just here for dinner a couple weeks ago. we still all, we don't just communicate, we travel together, we are like lifelong friends. But I've also noticed in my kids that that has changed, given that we didn't go to college with social media. So it was kind of natural to lose friends from your past. I'm not saying everybody did, but that I know for someone like me, I transitioned to my college friends much easier. I didn't keep in touch with people as easily, where now it's very different. But that experience has also changed at the college level. So I'm not sure that the $178,000 is worth a couple of friends. Like you'll
Right.
make those friends anyway in your 2 years, but you want them to have that bigger experience. And I think that's where a lot of angst comes from with parents.
I agree. And to be honest, my one daughter, there is no way she would have given up her 4 years at Penn State. She would have said, I don't care if it's $178,000 difference. I'm going. And she had the experience of a lifetime. And I could probably tell you that my son would say the same of his experience at West Virginia. I don't think there's any amount of money that would have mattered to them. Now that's easy for them because they were only paying a tiny piece of it. But
Right.
I think that, they wouldn't give up that experience for all the money in the world, which is great, right? I'm glad they had those experiences. So I don't know if I'd want to change it for them particularly because they did find their direction and they were confident with what they were doing. And while they may have changed their major or things of that sort, they found the path and they're both very successful and those kind of things, right? But um, that's just not the case for all young people. And so I think we need to just make sure we're giving those messages that kids can find other pathways. And in the meantime, they're going to be meeting some significant needs in our healthcare systems. We
Yes.
need these people to be able to do these jobs and do this work to be able to take care of all people in our hospitals.
Yeah, and I think, to talk about the costs also of college, the debt that kids incur these days keeps them, shackled to sometimes living in mom's basement for years because they can't pay off the debt. And so that even, or the family goes into debt with these parent loans, and it's just creating a very vicious cycle where if you do go into a training program, they could, even when you're working for an employer already, your degrees can actually also be paid for.
Yes, I'm glad
So,
you mentioned that.
what?
I'm glad you mentioned that because I forgot to. Yeah, at least a portion of it, right? Maybe not all of it, but all of the hospitals in the region provide tuition assistance. So, if you want to just take a longer amount of time to get there, you'd have to take a couple classes at a time, but you could potentially have almost your entire degree paid for.
Yeah, so there's like options, and we don't really talk. I'm so glad that you wanted to talk about this because it's the options that we want to stress. There's an option for you to get some free training, and we're talking college kids here, but really that option is available through the BCHIP team and Bucks County to all residents that want it. Obviously, there are constraints on it, so we just don't give it away to anybody, right? But in theory, like if you want to change careers into healthcare, or if you're in healthcare and you want to level up your skills, it's a phenomenal program. And if you are, on the fence about what you want to do, that first year of college can be a very expensive and ineffective way to find yourself. So
Mhm.
you may want to go nosy around in one of these training programs, get into a hospital then nosy around, find the right career path for you, and then spend the money or someone else's money, which I'm a big fan of. You
Yep.
spend your employer's money and go back to school.
Yeah, exactly. So it's just something I wanted to talk about today because it is having such an impact across all areas of our health systems. Like I said, behavioral health, physical health in our health system, senior health in our long-term care. And so we're really hoping that we can encourage not just young people, but people that are considering any change in career that might want to get involved in careers helping people, and that there are so many of these options out there for them to consider.
Yeah,
Excuse me.
fabulous. And therapists. Let's not forget about therapists because you
Exactly.
can't get an appointment with a therapist from what I understand, especially for your kid these days. It's almost impossible.
Yes.
Okay, Kim. Well, until next time, thank you for that wealth of information. I hope people are calling the BCHIP number to find out more info and how to apply and get your help.
Thanks so much for having me today.
Thank you. Okay, stop the live stream and